Okay, so tell me please, what's going on?
So
Go ahead.
I was involved in a car accident August 18,
Okay,
2015.
okay,
I was driving back home from Safeway
okay,
on 2nd Street. Well, I had a green light on 2nd Street coming up to B Street. The other driver of the other vehicle was trying to make a left. I believe it was a red light on his side. I had a green light. This guy all of a sudden goes for the left turn, and we make front end impact.
okay,
I slammed on my brakes to avoid an accident, swerved to the right, and it couldn't avoid it. It just happened.
okay. So head on collision. And how old is your baby that was in the car?
She was 18 days old.
It's horrible. Did you take her to a pediatrician?
She was seen at the hospital. Everything checked out fine. That she's a newborn. They said that her body's real flexible, so there is no way of her really getting hurt. She was in a car seat.
Okay, that's good. And then, did you go to a hospital after the accident?
Yes. My fiance was also in the car with us. She was in the back seat, right in the middle. She was transferred in the ambulance with my baby, and I was with them in the ambulance as well.
Okay. Which hospital was that?
Eden Hospital
Okay.
in Castro Valley.
Were you checked out as well?
Yes, they did a scan. They said all bones were intact because I had a previous accident
Yeah.
of April of last year. Did a backflip on a trampoline and fractured C1, C2,
Ouch.
C3, I believe, and then I had compressed fractures in my T1.
Ew.
There was multiple fractures.
Is your fiance gonna come in here as well for treatment, or she's okay?
She's been complaining about wrist pain because her body went forward, so I might bring her in. Yeah.
Okay, yeah. After we're done here,
Yeah.
we'll bring her maybe once then stuff will go. So I assume you have neck pain. So besides the neck pain, what else is hurting you?
My shoulder blades, my back. It's just a very sharp pain, constant pressure.
Okay.
It's always there. I was prescribed pain medication, Vicodin, Norcos, Percocets.
Okay.
They gave me inflammatory.
Too many drugs.
Well, I was taking. I was going up from each one. They would keep on giving me something stronger to help for the pain.
Any pain in your middle back and low back?
It's middle back.
Yeah.
Yeah. So they give me muscle relaxers and then for inflammatory.
I assume you have headaches as well, right? Or is that wrong?
It's yes, I do. It comes and goes. Yeah.
On and off headaches. How's the sleep?
I sleep through the night because of the pain medication. But when I wake up, I will always wake up sore.
Okay. What's the level of pain in your neck, 1 to 10?
It's always a 7, 8.
Okay, and lower back?
It's all the same because it's all.
Okay. Oh,
it's all in that area right here.
Shoulder blade as well?
Yes.
Same. Did you miss any time from work?
Well, I'm a self-employed.
Okay.
So yeah, I don't work for a company.
Okay. Okay. Let's take a look, see what's going on. So you said you had a broken C1. Does it hurt when I press here?
A little bit.
Yeah. Okay. Did the pillar broke on the left or on the right?
I don't remember.
Okay. But it's gonna show on your
yes, it
films,
should.
right?
Yeah.
Okay. I'll be able to take a look after we're done here. Does it hurt around here?
It's pressure. Yeah.
Right there.
Right there. It's the most pain right there.
All this.
Yeah. Not as much as a higher.
Okay. So you don't have any range of motion on your lumbar spine on the left, and your neck on the left as well. Okay. Bend forward, please. Back. Forward. Okay. Okay. Stand up, please. Face the window. March in place. One. Stop. Have a seat, please. Okay, so what happened to you is basically head-on collision. It's kind of opposite of the whiplash. When your head, instead of moving backwards first, it moves forwards first and then backwards. As a result, the soft tissue that support your spine, they have tear. So naturally, it's trying to heal back like this. And instead of healing back the same way, it heals back like this and creates these knots, okay? So do you feel like you're getting tighter and there's more pain, and do you feel like the pain medications don't work anymore?
Exactly.
So this is what's happening. These knots, they grow, and as they grow, your muscles and your joints, they get stiffer. So what we're gonna do, we're gonna break it up here, and we're gonna make them look healthy again, okay? Unfortunately, it takes about a second to get injured and about 100 days to get healed. And you already almost a month past due. When was the date?
August 18th.
So almost a month since the accident. So you haven't had any proper rehabilitation done to your body. So we kind of a month's passed. So all these knots, they kind of like they're pretty tight. Okay.
And also to my prior accident, I never
yeah,
therapy.
and that doesn't help as well. So what we're gonna do here is basically each time we're gonna come in, you're gonna get 4 different procedures. You're gonna get the electric stim and heat. Electric stim is going to send the electric current to your ligaments, muscle, and tendons, and helps to expedite the healing process. Heat will bring more blood. Then I'm going to adjust your spine. You ever been to a chiropractor before?
The last time I was a chiropractor maybe was when I was like 12.
Okay. So I'm going to adjust your spine, and then I'm going to see my massage therapist, and she's going to work on your muscles. So I'm going to see you for about 3 months. Okay. First month I'll see you 3 times a week, Monday, Wednesday, Friday, and then I'll see you twice a week. Second month, and then last month is only once a week. Okay. And then we're going to proceed with all the procedures. If you don't respond as I expected, then we're going to change and we're going to alter some course of treatment. We're going to add ultrasound and cold laser and some other stuff that I have here at the office. Okay. Okay. And then we'll just go from there. You're a big guy, and it's gonna need some serious amount of work to get you healed. Okay. Do you have any questions?
I do. For my neck, any injuries on my neck.
I'll be able. I'm gonna look at your films that you brought me while you're getting a therapy, and I'm gonna see how. I mean, it's been a year, so in a year since the accident, most of it healed, but I just want to make sure it didn't fuse. Okay. So I'm going to take a look at that. I'm going to do some range of motion. I mean, I'm not going to touch your C1 at this point in time unless I see that things are safe according to your MRI. Mm-hmm. But if it was just a compression fracture on your C7, T1 area, it's safe. You can even adjust compression fracture right after fracture. It's no big deal. It's just basically bone compressed. Yeah. There's nothing you can do about it. Because bone is porous. It's not like a solid metal that's going to stay. So when you put a tremendous amount of force in it, it will compress. Mm-hmm. But there's nothing dangerous about it. In terms of, I mean, it's not really healthy because it's going to alter the biomechanics of the spine, but it's not fatal. Okay? And I don't know how much of it you had unless I'm going to take a look at your films that you brought on CD, and then we'll go from there.
Because they also told me, I remember when after I broke my neck and they did all kinds of tests, I guess they told me I have a narrow spine. Also,
I'll take a look. I don't know I look at things differently because when you go to a medical hospital, a medical doctor, all they do is that basically they just check for pathology. We're looking at different things. Because we're not treating pathology, we're treating the cause. Okay? That's it. Okay? Alright, ready to rock and roll?
Yeah.
Alright. Okay, so look at your films on the computer. It looks like they had a right side of your C1 was broken off. That happened in May of last year. So most likely it healed, but we'll just stay on the safe side, okay? We'll just try to stay away from that area unless it really bothers you, okay? Okay. Now, most definitely it healed up. I just want to be make sure and be on the safe side, okay? So what I'm gonna do right now, I'm gonna adjust your entire spine. Your neck, the lower part of your neck looks fine, okay? In terms of the upper cervical spine, we would need to make a fresh set of X-rays, okay? So I'm gonna set you up for the MRI for the most recent injury, as well as the X-rays for your upper cervical spine, just to make sure everything looks good, okay? So we can move on with the adjustment of your upper cervical spine, okay? Okay, so put your hands down, okay? Take a deep breath in, out, okay, out, okay, out. Go on your side, please. Face me, or sleep on your side. Okay. Keep this leg straight. This straight. Just goes like this. Give me a hand. Okay, relax. Relax your shoulder. Okay. Sit up, please. Okay. Lean back a little bit here. This left side is really giving up.
Oh my god.
Feels better?
I've been wanting to do that for a long time.
Okay. Okay, so go on your side, face me. Keep this leg straight. Relax your shoulder. Relax it. Relax. There we go. Okay. Stand up. Okay. Stand on your feet. How does it feel? Feels a little bit more loose, or it's the same?
It's mostly like my left shoulder blade. It's
more loose.
well, no, it's pressure.
Oh, pressure. Okay. Well, we're gonna get some deep tissue work on that. You know, that's the shoulder blade. Most likely is the muscle that's that's pulling it. So we'll put it back in place. Okay. All right.